It's Saturday. It is the 5th of February. It's 2022. I think it's 2022. I don't know where I'm at. I still really sort of mentally feel like I'm in 2020 because I have sacrificed so much for the last 2 years for my care home. It's kind of like my personal life stood still, so it's a bit difficult writing dates. But really this video is for, and whether you see it or not is by the by because it makes me feel better, but for the care minister. Hi Gillian. You haven't blocked me here yet. And our health minister. I just really wanted to talk about what the impact and the damage is from my perspective. I can only speak for myself, but I'm very clear that I'm one of many, and some of the things I am talking about or going to talk about is relevant to a lot of people. I'm a small independent care home. I've really felt the impact. I don't have a large company behind me. Everything has been on my shoulders. It's no word of a lie. At the beginning of this, I was terrified. We locked down early. I have a bedroom in my care home. I moved in with my clients for the first 3 months of lockdown, and we locked down a week early. My client group is learning disabilities, so whilst we were trying to figure things out and trying different things and limiting foot traffic with staff, I was really clear it was hard. It was going to be hard for a pandemic and a lockdown is hard for us all to understand, but it was going to be particularly hard for my clients that we were locking down and that we weren't leaving the building. So I felt it was really important that I moved in and I was in that boat with them. So, it's all very well for us saying everything's closed, but staff were still coming and going, and if you weren't going out and seeing how everything was closed, it was confusing. So I really felt quite passionate about being here. I came down for initially, I think it was 2 or 3 weeks, but within the first few days I was very clear that it was going to be a lot longer. So my clients and myself, none of us really saw the empty high streets. It was quite a shock for me when I did eventually get to go home. We did really well, but the beginning of this, we were unable to get supermarkets to deliver. We were reliant on the supermarkets delivering. Also, I have health issues, so it was just as important for me to lock down with the guys and for all of us to be indoors. So I and my colleague had to spend a lot of time trying to get food to the house. We were utilising different options that was incredibly costly. My clients really aren't a fan of water. They like squash. So thank God for Amazon. We eventually got settled with Harvest Fine Foods, who came to our rescue. They're amazing. And DW Gillette Butchers, but I fondly call him Mark the Butcher because they came to our rescue in a really difficult time. So we weren't able to utilise supermarkets for quite some period because they just wouldn't deliver to us. And although if you were a vulnerable person, you could have got a priority, because of the nature of our care home and the forms for the supermarkets and calls I made to supermarkets, it just didn't work for us. They weren't helpful to us. So that was dire. At that point, pre-pandemic, we utilised really one main supplier for things, that would come under infection control or cleaning products and that. But the stock levels were just unreal and we couldn't get stock. So suddenly we were also having to source a lot of different suppliers to get things in, incredibly costly. I think at one point for a single bottle of hand sanitizer, I think I paid 40 quid. It wasn't a big bottle. I've actually kept it because, my God, it was so expensive. Even though it's empty, I can't bear to throw it away. So it was a really difficult time. So that period I was working very long hours every night. I felt the pressure of the world on me. I was responsible for my staffing team. I was responsible for my clients. There was very little known about COVID-19. Yes, we knew certain things about coronavirus. We definitely knew things about airborne viruses or viruses in general. So I was spending my evenings, reading up on viruses, reading up on transmission, looking to Italy and Spain that were a little bit ahead of us and listening to the doctors that side, seeing what their situations were, how it was impacting them. The first guideline that I recall had wording along the lines of, this is unlikely to affect care homes. This is when we were seeing Italy and Spain's care sector savaged. So at that point, it felt like I had woken up in a communist country and they'd forgotten to turn the internet off. That was quite worrying. Also during that period, we had the scandal of instructing DNARs to be in place. The email I got in regards to that, I did take legal advice on, and the wording wasn't so as an instruction, but it was definitely suggesting that we should think about it. And advanced care plans. Well, we had easy read advanced care plans in place anyway. Any client that medically needed a DNAR was in place, and that wasn't very many of them. So no other DNARs were put in place because it's immoral to, immoral is an understatement. It is criminal for some of the things. I'm very glad CQC highlighted that, and it's been changed. So that was the beginning, and reading science papers, looking at historical pandemics, looking at timelines, looking at impact, also taking into account, how we travel in this modern world, what the risk factors were. So for me, we were given a box of 200 fluid repellent surgical masks. At that time, our guideline was to solely wear it with COVID, but there was no testing. So I always felt that COVID was airborne. I didn't doubt that. So I thought it was really important to carry on as if it was. Those surgical masks, aren't really that helpful, but they're certainly not helpful if you are only wearing them with someone you think has COVID, when we wouldn't know if anybody else did have COVID. So we went into them as standard. That supply didn't last very long. When I ran out, I tried a lot of means to try and get more through essentially governmental sources, but I was unsuccessful. So I reached out to colleagues and friends and people in the industry, and was hooked up with a supplier that did have stock. So my staff really were and have been in masks as standard since the week before lockdown. That served us well. I had also in February, when we were hearing about COVID, I had put in an order for some, I think they were FFP2s. Unfortunately, they never made it to us. They were incredibly expensive. I did eventually get a refund, but I presume they were stolen in transit because they never came to us. I then was begging, because at this point, any established mask producer or seller was prioritising NHS. But and I get that, I understand that, but from my perspective, my clients are important to me. Their safety was important to me. Some of them are more vulnerable than others. Little was known at this point, so safety was a priority. So I ended up buying some full face respirators. So they are like a big plastic thing. Well, I don't know if it's made of plastic, whatever it's made of, with a clear plastic front, 2 filtration systems where you can replace the filters, but it covers your whole face and it's a clear front. I thought it was vital that we had something like that in stock in case we did have a case. From one of my begging letters or phone calls, I got in touch with a wonderful mask producer, and he took pity on us, and he did let me purchase some FFP3s. I was having to learn very quickly about masks, and it has been and always will be my belief that fluid repellent surgical masks are not effective enough to battle COVID. And I understand, perhaps in a crisis point you have to make decisions, and we have to think about stock and prioritising need. But we're quite a way through, but I'll get into that later. So I had a good stock of masks, but I spent a fortune before I managed to get in touch with this wonderful gentleman, Matt, from Mask Direct. I had purchased some FFPs at a massively increased price. So the money I have spent on safe, effective, robust PPE is beyond me. But I am not very financially motivated. I'm quite morally motivated. It was vital that we put morality and safety over profit, which I have done, which makes me feel quite self-righteous because I'm putting my mouth and my feet where my opinions are. It worked really well for us. In a lot of my videos, I've said, in my care home, I'm registered for 10. I've had 7 or 8 clients at different periods. I chose not to take clients during a certain period, again, prioritising safety over profit. We had a single client case, and that was from a hospital admission that occurred during the isolation period. Agency was in place, so 2 teams working separately. My team were in FFPs. We had different gowns, gloves. We had all sorts of stuff that I bought. And that meant that case of COVID actually didn't leave the room. Also, you have to remember when you're working with learning disabilities or maybe dementia clients or brain injury clients, there's a lot of client groups where self-isolation isn't going to be usable. So for a lot of my clients, it's just not possible for them to stay in their rooms for 14 days. It's just not an option. So it was really important we kept it out. And when we did have the case, his isolation period was extended. I have been lucky enough to be working with Devon Council with this particular client. They were incredibly supportive. Great decisions were made, and my lovely client recovered from COVID, which is wonderful, and nobody else got it. So that's amazing. I have had, I think, over the entire pandemic, 3 staff cases, but that it was external to the business, so it didn't spread and it hasn't really impacted us, although it does in terms of restrictions, not being able to take clients, closing down, suspensions and those kind of things. So, if you think about that time period, at the beginning, I literally would come up here into this room. Sorry, I've been having a droopy eye situation since I've been working the pandemic. Got tested for myasthenia gravis, but yeah, it's still drooping. So apologies. It's difficult for me sometimes to keep my eye open. But I used to come up here and I would cry. I'd bawl my eyes out. I was, I'm not ashamed to admit I was terrified at the beginning of this. I have health conditions myself. I was terrified that we were going to lose people. I mean, just thinking about it, it takes me back to the emotion of it. So for me, understanding is a coping mechanism. So as I said, I was reading science papers, I was looking at mold testing papers, looking at lots of different things and trying to learn very quickly. But this is after doing really long days. I was exhausted. So I would have probably been doing 84 hours a week of work, 7 days a week. And then I would, in the evening, be reading quite intense scientific research, peer-reviewed papers, all sorts really. And, my view will always be viruses aren't new, airborne viruses aren't new. The science world was predicting of a pandemic like this. History was kind of saying it's coming. We struggle with flu, so the influenza stockpile should have been better. There's a lot of things where we should have been ready and we should have been more prepared. And I will never get over the disappointment of realising or finding out, that the influenza stockpile wasn't really sufficient. And now when we look back and we think about, is it 8.9 billion wasted on ineffective PPE or unusable PPE or unsafe PPE or out-of-date PPE? I feel very self-righteous. I also had just lost my mum in a very traumatic way before the pandemic. So I sort of came from a very, very, very difficult traumatic personal experience into the pandemic. So I wasn't doing great. But my view is if it's me as one person in a very difficult time in my own personal life could manage to implement things that were beneficial and worked, I feel like I've earned the right to be a little bit self-righteous and judgmental of the government. We also started, I got quite into HEPA filtration, ion technology, UV sanitization, read a lot of things, again, HEPA filtration is used by NASA, was in existence long before the pandemic. So with that, again, I'm certainly no expert. I've just learnt to the best of my ability. You can get machines, from my understanding, that are quite intense. So they would have to be utilised in an empty room, because I think it's not good to be around humans. But from what I understand with the filtration systems I have, they're 5-in-1 air filtration systems. And how ions work is, so if we think of airborne viruses travelling on water droplets that are going to be heavy and drop to surfaces, and aerosols that are going to float around like dust does, when you catch the light, you can see dust, sometimes particles floating in the air. So if we imagine that's what COVID would be, but on a lot smaller scale. So ions work by the positive and the negative attracting, which creates a greater weight, allowing it to drop to surfaces, so then it can be cleaned away. So, there was lots of things that I learned and that I put into place, all of which was before the Infection Control Fund, which I have mentioned before. So I can't backdate those costings. So that's all been my cost. So we have 5-in-1 air filtration in communal areas. If a client is working one-to-one on a long-term basis, they have air filtration in their bedrooms. If a client is just utilising their bedroom on their own, we can utilise ventilation with windows, because staff really aren't working in there very often with them. They're coming and going. As soon as testing was available, obviously we've utilised that. I'm angry that we haven't created a mask culture or an education on masks, or sort of utilising FFPs as standard in the community. It would have helped me keep my vulnerable clients safe, and it would have helped other vulnerable people in society. And so if you think of all that and the emotional roller coaster, it's sort of before vaccination enforcement was announced, I felt like, we've got through this. I was really proud. I was proud that we hadn't lost anyone to COVID, and I was heartbroken to see how many people had been lost to COVID, how many loved ones were separated from people that we lost. I know a lot of people in different sort of parts of the sector, and hearing their stories will haunt me for the rest of my life. To anyone that has lost their loved one and were unable to be with them at that time, I'm so sorry. I really am. It was avoidable. So my view is that, the early figure of 40,000 at one point in care, I think our government has blood on its hands. I really do. That's my opinion. I'm entitled to it. That's how I feel. So, you get to a certain point, you catch your breath and you think, yeah, we're still in a pandemic. Corona's still a thing. Well, we're seeing new variants. That was always going to happen, and it will continue to happen. But I felt like, I can catch my breath. We've got things in place. I know where I stand. I know what I'm doing. My clients are quite settled. Everything's okay. And I thought, right, we can move forward now, and I can really focus on improving the service and doing the things that I had wanted to do that had been a bit slowed down by the pandemic and all that was involved with it. When it was first in the press about vaccination enforcement, I had conversations before, and people were saying, they're going to enforce vaccines, they're going to force people. I was like, no, they're not going to do that. Think of the Human Rights Act, Equality Act, Employment Law. They're not going to do that. But you did. And the damage was done as soon as it became a topic, as soon as it was mentioned as a conversation. And, we can't just look at it like that. We also have to look back on behaviour science and the lack of our government utilising behaviour science or understanding how people think. During the pandemic, there's a paper, conspiracy theories have grown during the pandemic. There's a paper, I think my favourite paper, her name was Karen M. Davis. I think the paper is something like COVID-19 conspiracy theories. It's available online. I'm sure if you Google it, you can see it. And it's just sort of highlighting why we were seeing an increase in conspiracies, and particularly around COVID. I think as humans, when something is out of our control, it can impact us in a lot of ways. And sometimes the impact is that we want control. So it becomes easier to take on board a different narrative because that feels safer. Also, it's a very negative experience. There's lots of studies on it. There was a study done, I think in America, where they took two groups. One group was given positive things. One group was given negative things to talk about. They had to talk about life experiences. The one group that was given negative things to talk about and their own personal experiences, both groups were given a conspiracy, and the ones that had just been discussing negativity there was an increased belief in the conspiracy that was blatantly, completely untrue. So, we understand a lot about humanity, psychology, people, how we engage, how we think. So I've always felt like during this, there hasn't been enough education, there hasn't been enough relatable, tangible access to science. I think Independent Stage are doing an amazing job of making that accessible to everyone. But again, it's only if you know about it, you're going to access it. So we've seen this increase in conspiracy. And my belief is a lot of it is fear-based, and I don't think we should judge anyone for that, and I certainly don't think we should punish them for it. I think it's a very human thing. I think we have to accept that humans do human things. So when we get to the point of talking about vaccination enforcement in the care sector, if it was the case that you were worried about the vaccine, enforcing it isn't going to ease your worries. So it was clear it was going to have a negative impact. It's naive at best to think it wasn't. And then when we think about there being no impact assessment before the vote, if we look at the figures of the consultation period, if we look at the figures that the independent care group had put out about what vacancies there were in July last year, and then the increase in vacancies, why did you do this to us? Like, we just got through a really hard period, and touch wood and thank God, thank the universe, whatever your beliefs are. I didn't get to sit and watch any of my clients die from COVID, and I'll be forever, forever, forever grateful of that. I did lose 2 clients during that period, but not to COVID, and that was heartbreaking enough. I've heard of so many people working or losing loved ones and hearing their stories. And now we know that the government was partying. I don't know, are we at 16 parties now? I'm not really sure. So when other people like myself were sacrificing, and a lot of us in care and in the NHS and frontline workers were sacrificing and being sensible and not being selfish and self-indulgent little children, let's go have a beer. Got to have a birthday party. We were sacrificing. So I'm disgusted. I'm absolutely disgusted. But I'm horrified that I can't add it up any other way than government is destroying care. You're destroying it. We're at a time, it's 2022. This is the time we should be moving forward, focusing on person-centered care by definition. Budgets aren't always going to be person-centered friendly. So is there a way that we can move forward and have different approaches on this? Is there a way we can think about modernising care? Is there a way that we could make things more accessible to different client groups and be conscious of different client groups? Care homes aren't just elderly people. Care homes and adult social care cater to a lot of different types of people. It is incredibly disappointing. Anything that I had from central government parts, I divide people into central and local. When I'm talking about local government, I'm not really discussing MPs. I mean, like your councils and that kind of thing. I've had amazing support from my local council, from Devon Council, absolutely outstanding. I can't say enough amazing things about my CQC inspector. I was struggling. So in care homes, you're not really supposed to use towels because of infection control. We were struggling to get centre feed rolls, which is the paper towel you use, like some people call it blue roll, to dry your hands on. I was really, really struggling with stock, and I was sort of writing policies and thinking. I remember I actually, my CQC inspector has been so supportive, and she put in a call, and I was actually in Asda, and I was like, look, I'm really worried about this. What if I get a whole load of towels, like so many towels, if I can't get any more stock, that we change it every half an hour or something, just trying to think, like, how can I limit the spread? How can I observe infection control with stock issues? So my CQC inspector, I can't thank you enough. You're awesome. You've just been amazing. Just support after support after support. But the reality is, even my CQ inspector, as amazing as she was, and local council, as amazing as there were times they couldn't answer my questions. I literally have every letter of concern I've ever raised. I have it digitally. I have the topics that I'd raised, and nobody's able to give me answers. And that's because central government should have been answering these questions. When I've written at the beginning about enforcement and my concerns and the impact it would have on us, and you've got to think about my client base. Familiarity with enforcement is really important. If you have non-verbal clients, it's even more so. We have positive behaviour support plans in place, so knowing them is really helpful to continuity of care. So suddenly creating a situation where there's going to be a staff turnover or losing a lot of staff in a short period of time, I didn't let anybody go who didn't want to be vaccinated, but I did lose staff that didn't want to be vaccinated, and quite a few in a short period of time. It then became really hard to recruit. This situation is unbearable. I am so tired. Because of the consequences of this, I've had to work incredibly long hours. I've put my foot down now. I'm only prepared to do an 84-hour week. I'm not doing 101 hours. I mean, if there was a massive crisis and it's for my clients, I'll do anything for my clients, but I'm not going to do it because somebody else wants something of me. I also would like to highlight, and this is nothing against anyone in these roles or positions, but a lot of people that are giving me things to do, please could I just remind you, a lot of you have 2 days off a week. You finish, maybe you work a 9 till 5 or even less. You have annual leave. You have sick leave. These are all things that I haven't really had access to for a long time. So I have a home. My clients are safe. My clients are awesome. I'm biased. I literally think I have the best clients in the world. I'm so proud of how they've negotiated the pandemic, how they wear masks, how they have a social conscience, how they've understood this and engaged with it, and how they've responded. You know, we created my clients like going out for coffee. One of the best things I bought at the beginning of the pandemic was Tassimo coffee machine. So we had our Liam House coffee cafe, and that was really helpful in in-house activities. I've learned a lot of things, bag making, all sorts. So proud of my clients. I'm at a calm moment. I haven't watched the news for a few days, which I think is always really beneficial. And this is a long video. We're now at 26 minutes 24. I think I'm probably going to have to YouTube it. But yeah, it's, you know, this is what it was really like in care. I couldn't get food. It was really hard to get products to clean. It was difficult. So when you've done a U-turn on NHS vaccination enforcement for obvious reasons because of the negative impact and the safety level, why did you not think about the safety level of care? Do my clients not deserve that kind of safety? Are my clients not important to you? Are dementia clients not important to you? Are brain injury clients not important to you? Are elderly clients not important to you? Like, you know. So I will hear any of your judgment when you're doing 101 hours a week, when you've got the record that I have, where you've put your feet where my feet have been and you've walked in my shoes. But until then, I will judge you. I will verbalise it. I'm so disappointed. And Gillian, Keegan, you blocked me on Twitter and you deleted my posts on Facebook. It's a bit embarrassing, love, you know? But anyway, each to their own. But yeah, also, just on the subject of Gillian Keegan, massive thank you to your office for sending me things like the Samaritans. As I was communicating on your page, I'm a big fan of mental health and well-being. And I obviously, anything you'd sent me, I was very familiar with. But I don't know if you're clear on Samaritans aren't there to fix the care sector crisis that was created by your government. You know, so I'm not going to be calling the Samaritans being like, oh, I need my staff. Vaccination enforcement has had a really negative impact. And I'm a strong believer in therapy. I do it every week. I have an amazing therapist. Thank God to him. He's also been one of the strengths in getting through this. Whether it's a pandemic or not, I think everyone should have therapy. I think it's really useful. Love CBT, cognitive behavioural therapy. There's so many things in life we cannot change, but we can change how we think about them. So I'm sure it was sent with good intention to a degree, the response to my email to your office. And thank you for telling me how I complain about you. I was aware how I complain about you in the first place, but thanks. But yeah, I'm really aware of how to keep myself well. I wouldn't be here now after the 2 years I've had in care if I wasn't. And I do find it a little bit patronising. And particularly, you know, at the time when I was posting, you know, you were posting photos of sitting on a terrace signing letters when there was a care crisis and how many hospitals were in crisis. But anyway, that's my judgment. It's my opinion. I'm entitled to it. As I've said, you know, maybe you do an awesome job in Chichester and in West Sussex. I don't know. Maybe people think you're great. I think if I just think about how you've engaged with me and how the content I posted triggered your team or you to take the action you did, I don't know if you've got what it takes. Care needs a lot right now, and we need a strong voice, and we need someone to think about the future. We don't need to be thinking about 5-year plans. We need to be thinking about 20-year plans. We need to be thinking about how things work. We need to be investing in it, and you know, we have to accept there will always be people in society that need certain levels of care, and it's vital we keep that going and keep them safe, and good quality of life, person-centred care. So many things are really important. So that's my rant for today. I think, because this is a long one, I think I'll probably start a YouTube channel, and I will be adding to it. I'm not really looking for anything past the point of I feel better for saying it and putting it out there. So yeah. But for everyone in care, you're amazing. For those that are left, you're amazing. For those that have closed their homes, I'm really sorry. I'm pretty sure this experience is what drove you to make that situation happen. For everyone that's lost loved ones, you're in my thoughts. I know that does nothing. There are no words. And I will close it in saying I'm really, really, really proud of my awesome clients. Unfortunately, I can't put them on camera because of capacity and understanding, so I like to protect their privacy, but I can tell you they're amazing. I can tell you they're thoughtful, kind, considerate, great senses of humour, just awesome people, and I am blessed and privileged to have worked with them during this period, some of which I have known since I was 22, and I'm quite a way off that now. And so whilst it has been horrific because of what the government's done, my clients keep me going. They will continue to be my priority. I will continue to do my best and go above and beyond for them, but I'm not going above and beyond for people asking ridiculous things of me, or things that don't follow science, or things that are just stupid. Don't have time for stupidity. I'm a busy woman. So yeah, it's still Saturday. Have a good weekend, and that's my black and white video for today.